Hey guys, welcome to the Mommy's Talk. Okay, the guest. Okay, so today we are going to talk on ectopic pregnancy, and it is a very informative one for every mother and whoever is trying to conceive. Uh, Without, I just want to trying it for a very long time. It's not working. It's working. Oh God, thank God, Aditi, we are here
Hi.
finally. Oh my God.
Yes,
Hi,
after
Aditi.
after 40
And
minutes
and
of
I was
trying, I
like, it's
think.
not. Oh, yeah, and I'm sorry, I don't know what was happening. I reinstalled the app and finally it's working.
Great.
And I was like, अब तो ये नहीं होगा. अगर इस बार connect नहीं होता, I was like, अब नहीं हो सकता है. Okay, guys, we are not going to waste a single moment today because it's a very, very important topic. Aditi, please introduce yourself to audience.
Hi, so I'm Aditi Murarka. I'm a mother of a almost 4-year-old. And earlier
Okay.
in 2020, in about March, I started blogging and it got serious somewhere in the middle of the lockdown. And my
Okay.
page has always been about positive parenting, gentle parenting, a lot of DIY activities. However, in November, I experienced an ectopic pregnancy. And
Oh, this was second pregnancy.
yes, this
During your
was my
second.
second pregnancy, and my first pregnancy was absolutely smooth and normal. In November, I experienced an ectopic pregnancy, and when I spoke to people, once I recovered and everything was taken care of, when I spoke to people, I realized there was not too much awareness. A lot of
Yeah.
people didn't know what it was, and a lot of people had actually been through it and never spoken to people about it because there are so many taboos
Yeah.
attached to, pregnancies going wrong or, miscarriages and all of that. So that is when I decided that it's a great, you know, way to sort of spread awareness, and it's extremely important so that if anybody
It's very
experiences this,
important.
they know how it's, what are the ways to sort of cure it, or sort of, what is the medical treatment available and what you can do to sort of, sort of prevent it from happening. So yes,
Yeah.
this is why I
Okay, so
decided to
so
go live here.
what is ectopic pregnancy?
So ectopic pregnancy usually happens when the implantation of the egg happens outside the uterus, which can be anywhere, but usually is in the fallopian tubes. And the
Okay,
reason
okay, okay.
for it to happen in the tubes is when your tubes have any kind of infection or any sort of a, sort of wound because of a previous surgery or something like that, right? So it's
Okay,
essentially
okay,
when
okay.
your fertilized egg doesn't move into the uterus, instead gets stuck in the tube itself.
Tube. Okay, okay, okay.
Yes.
So
So it's a tubal
so
pregnancy
you like
essentially.
it's
Yeah.
a acha acha. Okay, okay. So we can't avoid it. It's a natural thing, na?
It's an absolutely natural thing. Um,
Okay.
it's the usual cause for an ectopic pregnancy is, as I said, either you have an infection in the tube because of which the egg doesn't move down within the stipulated period, or if you've had
Okay,
a
okay, okay,
previous
okay.
surgery, or if you have an injury where there's a small lump or something in your tube because of which it gets stuck there. So it is, some because of either of the two
Acha, acha, acha.
reasons.
I am recalling a friend. She had this thing uh, after having a child. I mean,
Okay.
with this as you had, like in
Okay.
second pregnancy. Okay,
Okay.
but previously also she already had a miscarriage and washing was not appropriate. Washing away of what that happens with the first miscarriage. So is this can be the reason of ectopic pregnancy, right? क्योंकि अच्छे से वॉश नहीं हुआ था वॉश आउट नहीं हुआ था
It
इज
could
इट
be, but I won't be the
इट
right,
कैन
I will not be the right person to comment on that. That's obviously a gynecologist's area to comment on
या
why
या
it happened or what it happened. But
बट
that
दिस
is the
दिस कैन
usual
बी अ
reason.
रीजन
Yes, and my
या या
the main thing that I sort of wanted to emphasize on was this, that when an ectopic pregnancy happens, there will be a lot of people who will come around and say, Arey, doesn't it just slide down? Is there no way of dealing with it? Because obviously, terminating a pregnancy is very hard.
Yeah,
right?
yeah.
But what one needs to know is that the tubes are barely in mm's, and when the baby grows, you know how big the tummy needs to
Babies.
get, right? So
Yeah,
in
yeah.
most cases, if you delay any sort of treatment, it can lead to
Yeah,
a
yeah, yeah.
rupture of
People
the
delay.
tubes. So because a
Yeah.
lot of time is spent on maybe sab theek ho jayega,
ठीक
Bhagwan
हो
hai,
जाएगा.
everything will
Yeah.
get okay. There is that, there's that, obviously you hope for the best, but it's very important to know that if you're diagnosed with something like this, time is very critical, right?
Yeah,
Because
yeah.
any
Yeah.
rupture can lead to a fatal situation for both the mother and the baby.
And the
So
kids.
it's very
Yeah.
important to get medical help as soon as possible in such cases.
So when do you suggest to like do this washing away if a person comes to know that she's dealing with this ectopic pregnancy?
It's upon medical advice of your gynecologist, of course. So here
Okay, okay,
again, I
okay.
want to emphasize I'm not a doctor. I'm only here to tell
Mm-hmm.
you what it is
Your
and
story, okay.
yes. So essentially, the earlier the diagnosis, the better it is. There are two ways of treating
Okay.
it. There is a medicine, which is a very slow process. It
Hmm.
works for some people, it does not work for some people. And
Okay,
the
okay, okay,
second way is
okay,
a surgery, wherein they basically
okay,
remove pregnancy. So they are the two
okay. Acha, and what
ways.
about you? What about you? Like your journey of this ectopic thing. How
So,
did you manage? When did you come to know about, like, in which month, and how did you clear this?
for me, I found out about my pregnancy, and it had barely been 10 days since I found out. So I was probably in my sixth when I found out about when I had severe stomach ache in my lower abdomen. I woke up with
Okay,
shooting
okay.
pain. Till then, my pregnancy was going fine. I was just taking the folic acid and everything. And the minute I went to my gynecologist, the first thing he asked me was whether it is a concentrated pain on one side or is it regular abdominal cramping. But I said it was shooting pain on one side. So the minute I mentioned that, he had a doubt. He did a scan for me and he said, your uterus does not have anything. And my
Okay,
HCG
okay, okay.
hormone test confirmed a pregnancy. So he said then it has to be an ectopic. So that's when we did a second scan and we found out that the pregnancy, the sac, was in the tube. And the first
Okay,
thing
okay.
he told me was that you must get operated. So at that time, I did consult another gynecologist who did say that you can go for medication because it's very early. The diagnosis is well in time, it's early. But then she did tell
Okay.
me that for the medication, it basically sort of works like chemotherapy. It's very, very slow and you have
Okay,
to
okay, okay.
continuously be monitored. So you have to take regular injections. You have to be monitored to see if the mass size is reducing, if your HCG levels are going down, and all of that. So that would have
Okay.
meant long term, anywhere between 2 weeks to 2 months of separation from my child, firstly, because I would have to be
Oh,
hospitalized. Secondly,
acha, acha.
if there is a rupture while you are still taking medication, it would need an immediate surgery. And then that
Okay, okay,
surgery
okay,
will
okay.
be a very full-blown complicated surgery as opposed to a laparoscopy. So
Acha, acha.
with my so the choice was basically mine whether I want to go for a slow process which could have taken anywhere between 2 weeks to 2 months or go for a surgery. In with my risk appetite, I preferred the surgery.
Okay, okay, okay. So you
So
did it, acha,
yes,
as soon as possible.
yes,
You did.
I got admitted the same day because of COVID. There is one
ये तो
more
नीचे संयुक्त.
because of the COVID scenario, there's one more hiccup right now that you have to get your COVID testing done before you can get admitted. Otherwise, they will not take you to
Yeah.
OT. So immediately we got my corona testing done. The next day the reports came. I was admitted and operated. And I can only be thankful for timely treatment because I know how much
Okay.
ever I could have done, this couldn't have gone ahead.
So when did you come back to home? Like your son has to leave you
My
and stay
daughter,
away from
yes.
you.
So
Oh,
I
your
was in the
daughter, yeah.
hospital for 2 days. So
2 days, okay.
fifth and sixth, yeah, seventh I was discharged. So 2 days and one night, and I was able to walk after the laparoscopy. It is not as
Acha, it was
like a cesarean. Like
like Caesar,
cesarean,
Caesar.
yeah, yes,
Hmm.
C-sec was very painful. The recovery time is much longer. Laparoscopy is
Hmm.
not as big.
You had your first baby through C-sec or normal delivery?
Cesarean, cesarean,
C-sec, C-sec. Yeah, so
yes,
you know the pain. Yeah.
yes. That's
You
why
know
I'm
the difference.
comparing
You
it.
can.
Yes, I know the difference. Yeah.
Okay. अच्छा, it's nothing like that ना कि surgery की वजह से sometimes happens this ectopic pregnancy.
Should not be because in the surgeries they don't really touch your tubes, right? So it should not be
Yeah.
because of
So
that. But if you've had any
we
tubal
can't say that.
surgeries previously, then maybe. So one more thing which is which sort of my gynecologist advised and which I would want to mention here is that a lot of times it's better to go for a prenatal checkup, especially if you're at a certain age and you're conceiving after a certain age, like normally 30. It's really good to go for a
Mm-hmm.
prenatal checkup because when I spoke to my
Okay,
friends
okay.
about it, a lot of them said that we went for a prenatal checkup and in that we found out that our tubes were blocked. So they actually
Okay,
went for
okay.
a laparoscopy before they even tried to have their
Before
tubes
conceiving, yeah.
unblocked, and that way they were
Okay,
able
okay.
to have normal pregnancies.
Yeah,
So
this is
you
the
know
only
that is
option
the
actually.
only
Not the better
option.
option, only
Yes.
option where you
Yes, to
can
get a
avoid
health
it.
health checkup and
Yeah,
sort of
yeah.
and normally doctors don't suspect it in the second pregnancy because their take is that if your first pregnancy was fine, you don't have a tendency. They say you have a tendency for
Yeah,
ectopic pregnancy.
this
So
is
a
the issue
lot of
actually
people have
that
a
happened.
recurring issue. Yes.
अच्छा 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 अच्छा
That is
अच्छा
why it becomes
okay.
recurring. Yes.
Okay, acha, this is this thing. Okay, and what about your family and friends? Like, did they support in your
They
pregnancy?
were
Did they come to know
absolutely supportive.
supporting?
They were
Okay.
very supportive. In fact, it's because of them that with a small child we were able to sail through because
Yeah,
I'm
yeah.
a very involved mother and we spend a lot of time with my child. But with the rest and everything, they really took care of everything. The running around that needs to be done with the toddler and all of that. I was free from all that responsibility. I was able to rest, and now I have, recovered to a good extent.
Okay.
Yeah.
And what about conceiving again after having this surgery?
So
Like,
norm
if a person can plan, when does a person can plan after having this ectopic pregnancy for the first time?
So they say you should wait for 4 months post pregnancy.
Only 4 months.
Yes, 4 months.
No, no,
And
not post-pregnant. Acha, post-ectopic thing.
post
Acha,
ectopic pregnancy, you
ecot.
should wait for a period of 4 months before you can try again.
Acha, it's ectopic pregnancy. That also I don't know, and I'm like continuously telling
Yes,
it as ectopic. Okay. See,
yes.
this is what we know about. We don't know about it. Okay. And what else do you want to say about this? Like, what else like a person can do to avoid or anything you want to share? Throughout
So,
your journey, you felt which type of pain or how did you come to know and
so,
all?
the problem with
Just that
ectopic
pain
pregnancy
or
is the symptoms are very similar to regular pregnancy symptoms. A lot
regular
of because
pregnancy? Okay.
pregnancy symptoms itself are very confusing. Some people have pain, some people don't have pain. I didn't have any pain in my first pregnancy, but this time I
Hmm.
started getting severe pain. So it was an alarm for me. So
Something like
the
having a pain in periods. ऐसा क्या?
No, it was a throbbing pain
Nothing like that.
concentrated in
Okay,
just
okay.
one area. So
Okay,
that
okay,
is
okay.
what sort of signaled my gynecologist also. When I told him that it's a very
Okay.
severe pain in just one spot, like a muscle, not a general abdomen cramping like your period pain, right? That is when he said, okay, that's worrisome, so we must sort of see. So that is there.
Okay,
Then
okay,
a
okay.
lot of people experience spotting and discharge and all of that, which is very similar to regular complications of a
Okay, okay,
pregnancy.
okay. These also
So,
happens with this. Oh,
yes, yes. So, the severe symptoms in case of rupture can lead to fainting, headaches, etc. So,
okay, okay, okay,
that is
okay.
why it's without any medical check, it's very hard to say whether you have an ectopic
And
pregnancy
and
or not.
and like does this happen like people say कि हो जाएगा okay ये smoothly धीरे धीरे ये
Yes,
अपनी जगह
so
पे चला जाएगा this can
exactly.
happen क्या?
No, it can't happen. It can't
It
happen.
can't happen. If it
No.
is stuck, that means it can't
It
happen.
will
It
not.
can't
It
go
will
back to
not. It will
uterus.
not go back to the uterus.
Okay.
So that is one
Because the
decision where
same
a
thing
lot.
happened, I heard कि नहीं नहीं it will go back to uterus. Wait. We can wait for some time. This doesn't happen
No, no,
basically.
that doesn't happen. That doesn't happen at all.
Okay,
So
okay.
that is one thing a lot of people spend time waiting and wasting about that,
Yeah, yeah.
it'll
And
solve it at its own pace. It is not one of those things. It will not get auto-resolved. In fact, delays can lead to ruptures because your tube is very thin and the baby grows at a
hmm,
fast pace. So eventually it'll
yeah.
give up, the elasticity won't be there and it'll lead to a rupture,
So
right?
you don't have to you didn't have to remove the tube, na?
Uh, we did. because
Oh,
he
you did.
thought, so my gynecologist had a very different advice. He said that it is not always necessary to keep the tube because the tube will, you know how if you cut anything and retie it, there'll always be a knot,
Yeah, yeah,
right?
yeah.
So that lump will always
Mm-hmm.
be there. And sometimes keeping the tube can lead to more chances of ectopic pregnancies in the future again. Because
Okay.
if your pregnancy
Acha, acha.
again occurs from that tube,
Oh, so
then
this doesn't happen like if you're removing a tube and if you're with one tube, so 50% pregnancy already chances reduces.
yes, but then at the same time, you don't know whether your tube and that particular side was working fine in the first place. So it's very
Okay,
well possible for you to conceive with just one ovary and
one
one tube.
also.
But if you have a fallopian tube which is damaged and you continue
Hmm.
to keep it, then and if you conceive from that side again, then you will again have a chance of ectopic pregnancy, which is more dangerous then.
Acha. Okay, okay, okay.
Yeah.
And that is obviously not suggested by doctors too, right?
Yes,
To
yes,
keep a defected one.
yes.
Okay,
But then
so
again,
what happens if a person doesn't want pregnancy again after this ectopic thing? So they can keep the tube,
yeah.
just removing, just cleaning it.
See,
Oh,
that is
not an
again
issue.
just the gynecologist's point of view and your own personal
Okay, okay.
choice.
Acha, it's
Yes,
up to your choice. Like they did
yes.
they suggest you to either wash it away or remove tube? You got those two
So
options.
I left it on my gynecologist, and
Acha,
I
acha,
told
acha.
him
But you got
you.
options, na? You got those two
No,
options,
I
na?
was told that this is what happens. Now I will see if we feel like there's no infection and it is fine and it can be whatever, then my gynecologist told me that because of so and so reasons, I'm not in the favor of keeping a damaged tube. So
Okay,
hence
okay,
I
okay,
thought
okay.
his advice made sense and I went ahead with what he
Obviously,
said.
I know will never
Right.
suggest something bad.
So I
Oh,
really feel that, like, for example, two different gynecologists gave me also two different advice depending upon
oh,
as I told you, one gynecologist told me that medication may work, but it's a long and risky
okay, okay.
process. The other gynecologist said, I recommend surgery. I went for surgery. So a lot of things are personal plus your gynecologist's preference, right? So it can be
Yeah, yeah, yeah.
the treatment is, what your gynecologist and you mutually decide upon.
Which is painful, you'll say, like medication one or surgery one,
For me, I went for
and
surgery because
recovery time.
medication, obviously, you're not being cut open, you're not undergoing a knife. So, probably it is a cleaner process that way. But at the same time, it requires a lot of patience, a lot of faith, a lot of time, and a lot
Okay,
of
recovery time
perseverance.
is also
Yes,
more.
very, very high.
Okay,
So that was one
I
thing that sort of stopped me from going in for the surgery. And then also there's no guarantee, right? Because
okay.
if while you're waiting and while you're taking that medication, if there is a rupture, if there is a problem, you will have to go into a surgery
Ultimately,
immediately.
that is the final destination. Yes,
Exactly.
you'll say.
So for me,
Yeah.
I was like, I can't take that stress.
Okay, yeah, yeah, yeah.
So
And you had a small baby too.
yes, I have a 3.5, 4 year old, like almost 4 year old.
To that time, yeah, obviously.
Yes,
Chalo, thank
yes.
you so much for
But
sharing your thing. But
most welcome.
this is very important to share this thing because many people they don't know about it. And
Right.
what happens like उनको pain होता है and they say कि okay it's normal. Okay it's normal. Every time they say कि नहीं नहीं ये सब natural things है
Exactly,
and
exactly.
they don't understand this can be huge.
Yes,
So
exactly. So it's very important to sort of notice your symptoms because they're extremely confusing with regular pregnancy symptoms. So,
yeah,
a
yeah,
friend, I know people who have mistaken it for gas for 2 days and said it's severe
yeah,
gas and just
yeah,
taken
yeah.
a lot of antacids and a lot of this thing and then had to be rushed to the hospital. So, if you
Okay.
have any, and I think sometimes it's just good to trust your gut because if you feel like, no, there's something wrong, you should get it checked.
And what about this age thing? You say if it's like more than 30 years of age and planning to conceive, ye.
No, so they say that again, it's a body type. So if you have a chance, it can happen at, like you said, a first pregnancy or a second or a third. It can happen at any point. But yes,
Okay, okay.
most gynecologists these days do recommend that after 30, you should get a prenatal checkup before you conceive. So that just sort of flags off anything you should be
Suggestions
worried
of
or,
it.
yeah. So yes, that's what. If there are any questions, I'll be happy to answer them.
Yeah, guys, if anyone wants to ask anything about this thing, please go on. Well, I don't think we have a query. Hey guys, if you have any query about ectopic pregnancy,
Ectopic.
ectopic pregnancy. Okay, I learned it from her today. See, it's going to help any way, either you or anyone. So, guys, please, you're free to ask. If I get a query about it anytime,
Sure,
I'll
that'll be lovely.
I'll DM you for sure. Okay.
Sure. Okay, thank you.
अच्छा चलो चलो
Thank you,
and
Nidhi.
thank you for talking on these topics क्योंकि it you might have gone through pain that time for anyhow any type of
Right,
pain like
right.
like emotional pain and
Of course.
mental and mental torture also, it's a torture to leave your kid and go to hospital for 2 days and
Right.
still you're talking about it. This is great. You're doing great
Thank
actually.
you. Thank
Thank
you.
you so much for talking.
Thank you, Nidhi. Thank you.
Thank you
Thank you.
for your time.
Yes.
Thank you so much
You
for
too.
talking on this.
Bye-bye.
And if you want to say anything to our audience,
Nothing. Just take care of your health and be good. Yeah.
thank you. Chalo,
Okay.
bye. Stay
Thank you.
safe.
Bye-bye. You too. Bye-bye.